Ladies, if you have noticed excessive facial hair, hair loss, irregular periods, or missed periods, you could be suffering from PCOS. PCOS affects up to 13% of women that are in their reproductive age and accounts for about 50% of all cases of facial hair in women as a result of elevated testosterone. PCOS can cause menstrual irregularities and infertility. It is also associated with obesity, insulin resistance, and elevated insulin levels. If it goes unrecognized and untreated, it's a risk factor for cardiovascular disease. Also, patients with PCOS have an increased risk for endometrial cancer. In this video, we will go over what PCOS is, what signs and symptoms it can present with, and we will go over how to diagnose it and treat it. Welcome everybody, this is Dr. Valentine here at Houston Metropolitan Medical. So what causes PCOS? Well, at the moment, we don't know yet, but we do know what happens in PCOS. In the majority of PCOS cases, the ovaries produce an excessive amount of androgens. This is the primary driver of the condition's symptoms. And in about 20 to 30% of people with PCOS, the adrenal glands also contribute to the high levels of androgens, which can be detected by elevated levels of DHEAS. Elevation in androgens seen in PCOS lead to symptoms and signs like hirsutism, acne, oily skin, and hair loss. So how do we evaluate hirsutism and possible PCOS? When evaluating a patient for PCOS, we use the modified Rotterdam criteria, the most widely used diagnostic criteria for polycystic ovarian syndrome. And to meet the diagnosis, a woman must present with at least two of the following three criteria. 1 is problem with ovulation. 2, excessive androgens either clinically or in blood work. And lastly, polycystic ovaries, but we have to rule out other possible causes of elevated androgens as well. So during your office visit, we will ask if you have irregular or infrequent periods, called oligomenorrhea, or the absence of periods due to anovulation or amenorrhea. When we examine you, we will look over for clinical signs of elevated testosterone, such as acne, excessive hair growth on the upper lip and facial hair, like in men, and any signs of androgenetic alopecia. We will do blood work. We are looking for causes that can affect your periods, like pregnancy, thyroid disorders, primary ovarian insufficiency, and sometimes prolactin secreting tumors can affect your periods. We will include testosterone, androstenedione, and DHEAS, looking for excess androgen producing disorders like adrenal hyperplasia and Cushing syndromes. We will also order a pelvic ultrasound to evaluate your ovaries for multiple follicles or for ovarian enlargement, because about 70% of women with PCOS have polycystic ovaries. So once we have done the evaluation and workup and someone is diagnosed with PCOS, we would proceed with treatment. The first thing that we help treat is help the women who are suffering from PCOS with her ovulation. In women with obesity and PCOS, weight loss helps both insulin resistance and induces ovulation. For women who are unable to lose weight with lifestyle modifications alone, starting a GLP-1 like semaglutide might help. For women who are unable to lose weight and do not want to become pregnant, oral contraceptives can be started and will improve acne, hirsutism, and help with ovulation. So what about the patients who cannot or do not want to start oral contraceptives? Well, an IUD can be used for endometrial protection against endometrial cancers. Due to the higher levels of estrogens compared to progesterone, this can lead to endometrial hyperplasia and possible endometrial cancer. Another medicine that we could potentially use is metformin, which can also be used to improve menstrual irregularities and insulin resistance. Although this medicine, metformin, will have no effect on acne and hirsutism. The next area of treatment is treating the hirsutism or the excessive facial hair. Oral contraceptives have been shown to improve excessive facial hair, as spironolactone as well, as we've talked about it previously in another video. But in this case, spironolactone is to help regulate the excess amount of androgens and will help with the facial hair. Another medicine that we use for facial hair in women with PCOS is atorvastatin or simvastatin, which has shown evidence that women with PCOS, it can help with hirsutism. And lastly, if all of that fails, we can also try laser hair removal. So we have gone over what PCOS is and its signs and symptoms. We have gone over how to diagnose it and treat it. If you have enjoyed this video, please like, share, subscribe, and turn on your notifications to stay up to date with our most recent videos. If you want to learn about what you can do for hair loss, watch this video right here. Thank you for watching, and until next time.